Hi, I'm Jacqueline Chan. I'm an osteopathic physician, and I have a full-fledged license to practice medicine in the United States, and I also do what's called cranial osteopathy. And cranial osteopathy is the application of touch, therapeutic touch to the skull that affects the membranes underneath the skull that go all the way around the spinal cord and affects the fluid flow, the cerebrospinal fluid flow, which then provides 80% of the nutrients to the brain and the spinal cord and the autonomic nervous system, which control your digestion and your heart rate and your breath and your breathing. And one of the founders of cranial osteopathy, Viola Fryman, used this technique for babies after they were born who had birth trauma. And she was able to document changes and show that it could help prevent ailments that would otherwise arise from this, such as mental illness, attention deficit disorder, autism. And so my training is from the Ohio University College of Osteopathic Medicine, and I'm also board certified in family practice and neuromusculoskeletal medicine and holistic medicine. And I've been in practice for 10 years and moved from Ohio 2 years ago to Mill Valley, where I'm now at Clear Center of Health practicing here. So the reason I'm making this video is to ask you for your help to be part of a humanitarian project in which a minor contribution could help transform the lives of many children, thousands, potentially thousands of children in Eastern Europe and the former Soviet territories. And how this came about is that a former patient of mine from Ohio who adopted a child in Russia who had mental and physical deformities brought her back, and I treated her and she got a lot better. And through her experience in Russia and her now desire to adopt yet another child in the Ukraine, she has discovered a really pretty horrific situation in Eastern Europe in which about 3/4 of the children at these adoption agencies have misshapen heads. And many of them will go on to be labeled with a diagnosis of a severe mental handicap and will be institutionalized. And the mental institutions have bars on them, and most of the children will die within a year of being institutionalized, or usually around the age of 4 to 5. So here's a situation that can actually be prevented. And cranial osteopathy, which is well known in Europe and in America, is unknown in Eastern Europe. And I feel that myself and the other physician going with me, that we have the tools and the resources to really help with this situation. We're asking for $10,000 that would allow myself and Dr. Barbara Singer to go over there as the treating physicians, treat all the children in the adoption agency and possibly other agencies around the area, of which we've already made contacted and opened the doors of communication, and they are very willing to help and to bring us in. And with the involvement of another friend of mine who was in the Ukraine last year, ironically, or somewhat magically, if you will, in the Ukraine last year, training some young physicians how to do this type of work, that we can open this up for ongoing care. And not only that, but we can open it up for research in the field of pediatric osteopathy that can help other children with attention deficit disorder and autism from birth onward. So I thank you for considering this incredible possibility here to change and transform the lives of possibly thousands of children in Eastern Europe and the Soviet territories. Thank you.